Good morning, everybody. And again, welcome to this week's press conference. As you know, I usually start off by giving some indication of where we're at with vaccinations. Today, I really like to just do some reflection where we've been for the last year. This time last year, we started really the trek that we're on right now with COVID-19. At that start, if you remember, we really didn't know what we're going to actually have to contend with. We knew very little about the disease. We knew very little about how to respond to it. So again, I termed that, we started building the plane as we were flying it, really. And I have to say that over the last year, we've learned a lot about how to respond to a pandemic such as COVID-19. We learned a lot about how to, again, utilize our current resources. But what we really did realize is that how resilient our community is, how the residents of Lucas County can respond to any issue and overcome that. And I think we're seeing that. We're seeing the light at the end of the tunnel, but it's because of the work that this community did to get us there. So from all of us who have been responding, thank you, Lucas County, for all that you've done to be able to, again, do your part to really combat COVID-19. Well, so where are we at today? Well, brings us to the vaccinations. Today, we are looking at 80,270 individuals, or about 18.7% of our population have the first vaccinations. Total vaccinated, in other words, they have pretty much their immunity, is 48,047, or about 11.22% of our population have completed that vaccine series. So again, we're moving ahead. We're doing the right thing. We're getting vaccinated. Certain priority groups have been identified to be part of that phase 1D of Ohio's vaccination program. You heard the governor earlier this week. This includes those that have type 2 diabetes and end-stage renal or kidney disease. Additionally, phase 2B of the vaccine program will also begun today, which includes those that are 50 years of age and older. So again, you see the stepwise fashion that we're trying to work through until we can get to everybody to be vaccinated. Anyone a part of those groups can start receiving their vaccines today. Please remember, our COVID vaccine appointments for the area hospitals and health department clinics will be live around 6 tonight. Please visit lucascountyhealth.com to schedule that appointment. Also, please remember 1B groups, those 65 and older, those with those disabilities we've talked about, have a condition or disorder, still can and should be scheduling their appointment. So again, just because we're at that 50 years of age doesn't mean that those 60, 65, 70, 75, 80 and plus individuals should not be getting vaccine or again, they really should be getting vaccinated. Good news. I really think that this is important to really reflect on, is that CDC has released the first set of public health recommendations for us that are fully vaccinated. Important. Again, this is another step to getting back to a more normal life. People are considered fully vaccinated from COVID-19 after 2 weeks from that second dose from Moderna, Pfizer, and 2 weeks if it is that Johnson & Johnson one-shot vaccine. That's when you consider fully vaccinated. Just want to make sure that we understood that. The following recommendations apply to non-healthcare settings. So fully vaccinated people can visit with other family vaccinated people indoors without wearing masks or physical distancing. Visit with unvaccinated people from a single household who are at low risk for COVID-19 disease indoors without wearing masks or physical distancing. And can refrain from quarantine and testing following known exposure if asymptomatic. Fully vaccinated people should continue to take precautions in public while by wearing a mask that's well fitted and that physical distancing. Wearing masks, practice physical distancing, and adhere to other prevention measures when visiting with unvaccinated people who are at increased risk for severe COVID-19 disease, or who have an unvaccinated household member who is at increased risk for COVID-19. Wear masks, maintain physical distance, and practice other prevention measures when visiting with unvaccinated people from multiple households. Also then too, avoid medium and large size in-person gatherings. Again, the social distancing aspect here, and not going to those large parties where other individuals could, again, not be vaccinated or have COVID-19. You need to get tested if you're experiencing COVID-19 symptoms. And again, follow guidance issued by individuals' employers. So it's part of the press conference now where, again, you're going to hear about busting some myths. And again, we have another great episode of Mythbusters COVID edition. So Tom and Rhonda, please take this away.
Hi, Tom Cole here for Vaccine Mythbusters, episode 6. Where Rhonda and I are so excited to be able to give you these episodes every week. And it's so interesting to me because our community is pulled together. We're getting vaccinated. People are positive about it. The sun's out. Temperatures are 60. We're getting ready to play baseball. There's light at the end of the tunnel. The hope for a great summer. Everything is aspirational hope, and it's good. And speaking of hope and aspirational, one of my all-time best friends in our community, superstar Rhonda Sewell. Rhonda, how are you?
Oh, I'm so happy to be here with you for another episode. And Tom, I'll cash app you for all the good things that you just said. It's so good to join you another week of myth busting. And I'm so pleased that we have been able to help the Toledo-Lucas County Health Department and the V Project to really get the most accurate facts out there about vaccines. And I see we have a very special guest with us today. Tom, do you want to make the introduction?
Certainly my honor, Rhonda, and you are spot on as always. It's great to have we've got the expert on today, Dr. Carl Fernandez, exemplary doc at the Toledo Clinic. Dr. Fernandez, thank you so much for joining us on Mythbusters.
My pleasure. Thank you for having me.
Dr. Fernandez, there's been a lot of talk about which vaccine someone should get, and recently, especially about the Johnson & Johnson vaccine being less effective. What do you think about that?
I think it's very important to get whichever vaccine is available first. They're all equally fairly effective at preventing serious illnesses. And that's the goal. We don't want people in the hospital. We don't want people in our ICU. So whichever one you get is the one you should take. The Pfizer and Moderna are 2 shots, and you have to get both shots to have adequate immunity. Johnson & Johnson is 1 shot, and all 3 protect against serious illnesses.
I like to say, Dr. Fernandez, one and done. That's a great way to think about that particular shot.
Yeah, that's right. All the studies that were done for Pfizer and Moderna, which are the 2-shot vaccines, were done with 2 shots. So it is very, very important that if you get the Pfizer or Moderna, that you keep your 2nd shot to get adequate immunity. The Johnson & Johnson, if you're afraid of needles, if you're not good at following up things, 1 shot and you're done.
I really appreciate you. Thank you so much for being here, Dr. Fernandez, and really clearing up some of the myths and things that we're hearing out there. This is the place to come for the most accurate information. We appreciate your expertise, and we hope to have you back on Mythbusters soon.
Thank you very much.
Doc, you were fantastic. You really were. And Doc, also, some people are getting information on Facebook, and many of those folks, they maybe are well-intended, they mean well, but a lot of times the Facebook information is not accurate information. So you make sure that you talk to your family physician and get the absolute accurate information. And also you can go to a webpage, the Lucas County Health Department webpage or the V Project webpage to get that information. Doc, thank you so much for being with us.
Thank you again, Tom, and thank you again to Dr. Fernandez. And as you always say, Tom Cole, stay safe and stay informed.
Again, another great episode of Mythbusters. And again, if you're looking for the vaccine, get scheduled, and whatever vaccine's available, please get it. Whichever one comes at you first, that's the one you should take because they're all equally effective. I'd like to kind of close out today's press conference with talking about St. Patrick's Day. It is coming up, and again, many of us are going to be interested in going out, again, trying to get back to a more normal life. Maybe again, getting out with friends and family. I want to caution us, though. Again, like other holidays, we need to be responsible, at least for the time being, ladies and gentlemen, because again, getting together in large crowds, we could have an issue with COVID and seeing a spike. So if you are going to go out, remember all the things that we've talked about for months now. Wear your face mask, stay socially distanced, stay within inside of your bubble. In other words, your friends and family that you know are, COVID sound, so you're not going to infect yourself. Again, make sure that we're following those guidelines. And again, all those bars and restaurants are still going to have to follow the guidance that has been set down by the governor and the Ohio Department of Health about wearing masks, social distancing, and seated to be ordered. So again, they are going to have to follow those as well too. We're making great strides, ladies and gentlemen. And again, weather's breaking. We want to get out. We want to get out and about. We still have COVID in our community, but again, things are starting to turn for the better. We have vaccine in our community. We're going to get much more in the coming weeks. So again, just a little bit longer. We're almost there, and we're seeing great strides. So with that said, I'd like to open up for questions.
Bree with Channel 24, you may ask your question.
Here, good morning. Two different questions. First, I know I had asked last week for numbers, so I'm not sure if you would have this updated one of how many people currently with all of the new phases are eligible for the vaccine in the county. And then just also what amount of shipment of vaccine are we getting? I know for Johnson & Johnson, you expected it to be around, 100 doses, or maybe 500, sorry, per week. Just how much we're getting in now.
Yeah, let me answer the first one. The idea here of Johnson & Johnson is that it's not coming online that fast. Well, we're going to be seeing more of that at the end of the year, at the end of the month, excuse me. Nobody got any Johnson & Johnson this week within Lucas County. We received 2,300 doses of Moderna. And then we received, I think, 10,000 doses total in the community. That includes us and the hospitals. When we're looking at that total number, we're looking at probably around 165,000, give or take. Again, we're trying to get better numbers on that. It's just really difficult when you start looking at some of the conditions and things of that nature.
So to clarify, about 165,000, you would estimate people are now eligible.
Yeah, again, that's kind of where we're at right now. Again, trying to dig through some of that data is tough.
And then why did we not get a Johnson & Johnson shipment this week?
Again, just not enough doses in reserve, from what I understand. Again, that comes from the federal government to state government.
Do you expect to get more doses next week, or is that kind of
again? I hope so. I would think definitely by the end of the month we'll be starting to see a lot more.
Great, thank you.
Sure.
Amy, go ahead with your question, please.
Hi, Eric. We heard the governor talk about these mass vaccination sites that are going to start popping up around Ohio. As it stands right now, do we know any plans, what they're looking like for having one here in Northwest Ohio?
Are you saying the mass vaccination sites, or are you saying the one like they have in Cleveland? The one that they have in Cleveland downtown is a megapod, if you would. They're able to handle a lot more individuals coming through. So we're not going to get one of those, but we do have a mass vaccination site that we're working with the state to, again, make sure we can stand up. That is the rec center. So that is designated as one of our regional mass vaccination pods, point of dispensing.
I got some numbers from Shannon yesterday and kind of did the math on how many people kind of get added to the group today in Lucas County, and it looks like it's around 84,000, if those numbers are correct, based off, the eligibility opening up. Are you guys seeing enough doses coming in to accommodate that?
Again, the supply is nowhere near the demand at this point in time. Yesterday, we opened up a link for the rec center for Saturday, thinking that we'd announce that today. It got filled up before we even got in this morning. So that there is definitely a demand.
Melissa Veitch, go ahead and ask your question.
Yes, thank you. Good morning, Eric. Let's go back a little bit to our mass vaccination site in Maumee. How soon could we see that open up as a means to, obviously we're using it now to vaccinate people, but how soon and how large will that site be and be able to accommodate as we get more vaccines in?
So that site, we're probably able to do 20,000 doses a week. Right now, we're probably looking at anywhere between 2 to 5,000 a week as we progress through this mass vaccination FEMA type of pod. So again, I would expect us in May to have significant doses going through there. I wish I could go ahead and give you a good number. I just don't know yet.
Okay, and that kind of goes back to my next question. When we talked about, you said we got about 10,000 vaccines in, excuse me, this week, and that included everybody. And we're talking what, I think she was saying 80,000 people in this age group. I mean, how quickly do you think we can ramp up the doses? You're obviously not getting any indication as to how fast those are going to come in.
Yeah, I do not know. We're again at the rec center. We've already been able to push 3,000 through in a day. So it all depends on how fast we can go ahead and get doses in.
Okay, thank you.
Sure.
Caitlin, go ahead and ask your question, please.
Hey, Eric.
Hey.
So the governor has set this goal of getting down to 50 cases per 100,000 population before he'll remove some of the remaining safety restrictions. Do you see that as an achievable goal? And based on how Lucas County's numbers are trending, how quickly do you think we could get there?
Again, I wish I had a crystal ball. The 50 per 100,000, I think our numbers are, let's say about 180 per 100,000 in Lucas County, give or take a little bit there. I haven't looked at the data this morning. So we got a little ways to go. We're seeing on the average about 50 cases added to our caseload every day. So we're still seeing disease in our community. I would say, again, depending on how fast we get vaccine out, how well we still do with mitigation strategies, weather is breaking, we'll get outside a little bit more. So, we might be able to see that maybe by June, May. Again, there's so many variables involved. I know people want me to answer that question or some of those like questions, but it's just hard. It's just hard. So, maybe June.
Bree, go ahead and ask your question.
Another follow-up. So earlier in the week when the governor announced the next phase, he said that part of that decision came from talking to health commissioners around the state, saying that, the health commissioners wanted to open it up to more, but it sounds like there's still, a high demand. So talk about what that's looking like here. And if, we have these large numbers of people it's opening up to, but then not quite enough vaccine coming in, how that's working.
So let me do this. So we're over 18% of our population has begun or is vaccinated. Other communities, they're at 7, 8, 9%. So we have more people vaccinated. Some of those other counties, their population isn't taking up the vaccine as fast as ours for whatever reason. And what we have is we still have demand in these age groups where some other counties don't. So, we still have demand, others don't. So the governor's trying to, again, not just have another county sit and not do any vaccines. So what he made that decision is to open up further. So there's some of the health commissioners that are like, no, we're fine right where we are because of the demand. Other health commissioners were looking at their counties and saying, you know what? We no longer have demand in this age group. So he made the decision to move everybody. And again, it makes our jobs a little bit easier because now, again, as soon as we set up a link like we did last night, it fills up. And so that's a lot easier for us to, again, logistically and organizationally be able to give those vaccines. We did see a little bit of a downturn. What was that? The last week when we had some spots, that weren't filled. So again, we did see that, but now we're in that 50 plus category. And so again, we're going to see that demand, and at some point in time that'll get saturated. I'll let the governor know that we're saturated, and then he can make a decision maybe to move down another 5 years because of us.
Perfect. Thank you.
Sure. So let me
Melissa, go ahead with your question, please.
Melissa, can I just make a correction? I said 165,000. It's actually 156,000 individuals in that priority group. So my fault. I was off a couple thousand.
That's okay.
Thank
Hey,
you.
we're exactly a year from when the governor, declared a state of emergency in Ohio, and we literally, went into what we've now seen, play out over the last year with the COVID pandemic. A year ago, we were really struggling just to get people tested here in Lucas County. What is the greatest lesson and takeaway that you have over the last year in dealing with this pandemic?
Yeah, can I give you two, if you don't mind? One is this community is resilient, and it really understands how to respond to an event like we just had, and they've done a great job. But I think the other one is just not for Lucas County; it's for the entire United States. We can no longer ever rely on a foreign country to supply us with things like N95 masks or reagents for test kits. We really, when this is all said and done, we really need to rethink that approach to how we supply ourselves with those medical devices or the test kits or just the ability to respond. That needs to get fixed. And again, that is something that we all should be lobbying for in this country to make sure that that never happens again.
Okay, thank you.
Sure. I do believe that is all for today. Again, thank you to the media for getting the message out. We rely on you heavily. And again, we'll go through another week and see where we're at. And I know this community is going to get vaccinated, and we are going to quickly return to normal. Again, thank you, everybody out there.